Thank you for 20 years of Get With the Guidelines. We've got a lot to celebrate, and we're so happy you're here. Here are a few of the things we've accomplished together. Together, we've tracked more than 10 million patients. Data has been used in more than 600 scientific publications. Since 2016 alone, we've given out almost 32,000 awards to participating hospitals. None of this would be possible without you. If you're one of the nearly 2,500 plus hospitals across the United States and Puerto Rico to implement Get With the Guidelines, thank you for your outstanding performance treating patients with heart disease and stroke with the highest quality care. Get With the Guidelines helps healthcare professionals improve patient outcomes by applying the most up-to-date, evidence-based treatment guidelines. Whether those guidelines are for stroke, heart failure, resuscitation, AFib, or coronary artery disease, hospitals that encourage their consistent use help patients do better. That's quality improvement, and it's what we're all about. Thank you, and here's to the next 20 years together.
Hello, everyone, and welcome. I'm Kevin Harker, the Executive Vice President for the American Heart Association's Midwest region, and I want to thank you so much for taking time out of your day to join us today. I know we'd normally be in a ballroom eating dinner together for this event, but by now we're used to things being a little different, right? This is especially true for you, our hospital partners. And I want to first salute you and thank you for your amazing work during this pandemic. We are so grateful for each of you and the way that you and your amazing colleagues have gone above and beyond during this challenging time. So thank you. And today is a great day, isn't it? It's opening day for baseball and fans are in the stands. March Madness is wrapping up this weekend. I'm sorry if your team is out. And after a tough winter, spring is here, and I hope the sun is shining wherever you are today. And what makes it even better is that we are thrilled to be able to celebrate each of you for your amazing work in saving lives and changing lives from the devastation of stroke today. As you know, this event is for the 13 states in the Midwest. And to kick us off, I'd love to have you type the city and state that you are joining us from in the chat box. This will just make it a little bit more interactive. It will be great to have all 13 states represented, from North Dakota to Kentucky, from Kansas to Ohio, and everything in between. And so if you can go ahead and, I see Iowa, I see North Dakota, I see Ohio, Illinois, Ohio, Michigan, welcome Illinois, Minnesota, Kansas, Ohio, great. Thank you all for joining us. That is so fun to have so many individuals joining us from that Wisconsin, Ohio again, Kentucky, Illinois. Great to have you all join us. Thank you again. So go ahead and keep tapping at the chat box. And as we move into our agenda, today, this celebration is all about you. We know that you might be joining us over lunch break before you get back to the business of saving lives. And we also know that some of your colleagues are not able to join today. And so we're recording this program, and we will share the link so anyone who could not attend can view it later. So we are so pleased also to be joined today by several extraordinary partners in this relentless movement. First, Dr. Bj Hicks, a stroke neurologist and board member from Columbus, Ohio, and Alicia Radesha from Omaha, Nebraska, who will share her amazing story of survival and triumph from a devastating stroke as well. We also have wonderful messages from our national CEO, Nancy Brown, and two national leaders in stroke care, Dr. Lee Schwamm and Dr. Stephen Messe. On behalf of all of our volunteers and staff at the AHA, I want to thank you, each and every one of you, for the work that you are doing. Your relentless commitment to quality care especially during this past year of extraordinary challenges, is appreciated and celebrated. We usually have the opportunity to present you with a certificate and shake each of your hands on stage, but this is a new world we're living in. And since we're together virtually this year, your photo will be presented throughout the duration of the event today. So again, please feel free to give shout outs in that chat box to celebrate with your colleagues. So let's get our program started with a message from the American Heart Association's National CEO, Nancy Brown.
Hi, I'm Nancy Brown, CEO of the American Heart Association. Thank you so much for joining us today and for powering our mission to be a relentless force for a world of longer, healthier lives. Science and research are the bedrock of the American Heart Association, and a key pillar of our work in bringing science to life is our Get With the Guidelines Quality Improvement Program. We launched the program in the year 2000 to assure that patients with coronary artery disease received high-quality, evidence-based care during their hospital stay. Over the past 2 decades, Get With the Guidelines has expanded to include heart failure, stroke, atrial fibrillation, and most recently, the COVID-19 cardiovascular disease registry. Stroke is the largest of our Get With the Guidelines programs, with more than 80% of every stroke that happens in this country captured in our registry. In just over 2 decades, you, our valued partners in hospitals across the country, have collected data from more than 10 million patients, profoundly deepening scientific understanding of cardiovascular disease. This work is more important than ever as the world confronts COVID-19 because severe outcomes are most common in people with a history of risk factors for heart disease or stroke. Hardest hit are Black, Hispanic, and Indigenous individuals living in under-resourced communities. As a champion of health equity, the American Heart Association is leveraging its voice, our platform, and our resources to identify and remove barriers to healthy living. Our Don't Die of Doubt campaign informs the public that hospitals are still the safest place to be in a medical emergency, as we urge people to call 911 at the first sign of a stroke or a heart attack. As a founding supporter of the Ad Council campaign to encourage COVID-19 vaccination, we are boosting public confidence and helping to keep people safe. We are also encouraging everyone to get their flu vaccination and schedule routine and preventative care. In 12 months since launching a 3-year hemorrhagic stroke initiative with Alexion, we have identified best practices and additional insights that we look forward to sharing across the country. None of this would be possible without your heroic efforts on the front line of stroke care. During an extraordinarily challenging year, you have displayed uncommon courage, collaboration, and clinical excellence. On behalf of all of us at the American Heart Association, thank you for your dedication to ensuring all people have the opportunity to live a longer, healthier life.
Very inspiring, and love hearing how she talked about your heroic efforts, and we couldn't agree more. I'm also loving to continue to see that the chat box filling up with your locations. Thank you for joining us as well. And now I'd like to introduce you to my friend and colleague who has agreed to be our MC today. Like many of you, he's joining us between rounds as well. So Dr. Bj Hicks is a member of the American Heart Association Midwest Regional Board of Directors. He's also the immediate past board president of the Columbus market, and in his spare time, he's the co-director of the Ohio Health Riverside Methodist Hospital Comprehensive Stroke Center. Bj, it is so great to see you. It's great to see you in a suit, in sport coat. It feels good to be getting a little bit back to normal now. And so welcome, and now I'll turn it over to you.
Thank you, Kevin. First time in a year wearing the suit, so I'm happy to report that. Thank you for noticing. It's really an honor to recognize the life-saving work done by the many health professionals on the call today. Your participation with our AHA quality programs and commitment to quality stroke care is literally saving lives and improving outcomes for all of our stroke patients in our Midwest region. So a hearty congrats to the nearly 400 Midwest Get With the Guidelines stroke hospitals who've achieved over 1,000 stroke awards. Now, these awards are based on the 2019-2020 data for those keeping score at home, since it's opening day, as Kevin so eloquently alluded to. Now, these awards represent your commitment to guideline-directed care for every eligible stroke patient, ultimately saving lives and improving patient outcomes. Now, this year, many of you attended the AHA's International Stroke Conference, or ISC, virtually, and heard the progress and impact we are making in stroke care, including how mobile stroke units, some a little larger than this one here, but mobile stroke units can improve outcomes and reduce disability, new AHA, EMS routing recommendations, endovascular intervention, and so much, much more. We also learned that there's a lot of work that's yet to be done, particularly how structural racism is impacting outcomes for particular patients based on zip code. The health inequities we must address that are providing so many disproportionate vascular risk factors, and the issues that impact the quality of life for stroke survivors and their caregivers. Now, despite the virtual setting, we're still able to come together and learn from one another. Now, through the Get With the Guidelines and your connection through the AHA, your individual stroke teams are contributing to the knowledge and enhancement of stroke care nationwide and worldwide. Now, next year, we look forward to gathering in person in New Orleans. God, Lord knows I do. I'm really looking forward to that. And celebrating together at our annual recognition dinner. So on behalf of the AHA, a heartfelt thank you for your resounding commitment to our communities that you serve and the patients that you treat. Now, we're in for a treat, as our next guest is a stroke survivor and an interior decorator from Omaha, Nebraska. I'd like us all to meet Alicia Radesha and a few members of her family. Alicia?
So, we start by taking the mask off.
Okay. All right. I'm Alicia Radesha. I am 31, Omaha native, born and raised here.
Alicia's very determined. Always kind of been a go-getter. Has her eye on the prize and is not satisfied until she obtains it.
I'd say that's a fair assessment.
Alicia is a mix of a bunch of different personalities. I feel like she's super fun, super exciting and energetic, but also she's super detailed oriented and loves things exactly how she has them planned and doesn't like to deviate from that.
Like, let's put in like mirage effects, right? It's like, it was a day like any other. But no, like really it was. On February 28th, 2019, that evening in particular, I was taking a cooking class at Metro Community College. It was fun. Got home at 9:30 and took a bath, starting to relax. And as I was getting out of the bathtub, like, I got really lightheaded. That lightheadedness turned into some like blurry vision. Like, oh, this hasn't happened to me before, but it's fine. I have a meeting in the morning. I have a 7:30 meeting with my boss. I don't have time for this. Like, I have to get back to normal.
Alicia called me. I answered the phone. I was like, hey, what's up? And then she was like, hey, what should I take for an allergic reaction? And I'm in nursing school, so I'm kind of always the go-to with my siblings, being like, hey, what do you think I should do? And so I was like, well, why do you think you're having an allergic reaction? She just like keeps talking to me and tells me that part of her face feels a little numb. And you learn a lot in nursing school, but no one ever prepares you for having a conversation with like your loved one. And how are you supposed to tell somebody that you think they're having a stroke?
Now, please join me in welcoming Alicia to share more about a remarkable story. Now, Alicia, we're so grateful to have you here in person. Can you tell us a little bit about what happened after that phone call with your sister? I think we're all waiting with bated breath to hear the rest of the story.
Thank you, Dr. Hicks. It's an honor to be here. And I'm sure it doesn't come to much surprise that when my sister started to be very inquisitive about what reactions I was feeling, it was met with much resistance. It's like, what are you talking about? There's no way that I'm having a stroke. Sure, half of my face is going numb. Sure, I can't see. Sure, my arms are starting to tingle and go numb, but I'm young, I'm healthy. There is no way I'm having a stroke. And so at this point, I am also just thinking, I have to move on. Like, I don't have time for this. I have a meeting. And I was really on the edge of ignoring what my sister was saying and going to bed, hoping to sleep it off. Or the other option was to go to the hospital. Thankfully, I listened to her. And thankfully, I did it in a short amount of time where as soon as I was able to get to the hospital and they activated the stroke, things moved very quickly and they administered TPA, which was certainly life-saving. I know for a fact that I would not be here today in the condition I am in front of you all if it wasn't for that. So as you all know, timeliness is of the utmost importance in these situations. Following that, I did all the doctor's orders because I was still in that mindset of, I don't have time. I don't have time for a stroke. I don't have time for all these side effects and ailments. I need to get back to normal, something we're all very familiar with saying and feeling. So I enlisted myself in occupational therapy. My vision was really rough, and did a lot of physical therapy, emotional therapy. And it was a really trying and difficult recovery. And I'm sure as many of you know, whenever you experience a sense of trauma, it doesn't hit you right away. So for a while there, everything was fine. I was checking off all of the boxes. And it wasn't until about 2-3 months later did it really start to hit me that, wow, this happened to me. This really changed my life. And it's taken a while through that moment to get to a sense of feeling a sense of honor and pride in being a stroke survivor. Being here with you all has really helped and is exciting and empowering for me. To see that people care and they want to hear the story, and it's been a journey.
Wow. Well, Alicia, thank you very much for sharing that powerful story. I think you and so many other stroke survivors, you're the reason why we get up in the morning, why we get up at night. You know, this is a 24/7, 365 business, and it's to impact patients and individuals like yourselves and go from stroke survivors to stroke thrivers. So really a heartfelt thank you for sharing that powerful story. And, you know, you inspire us to all remain relentless together. And now it's my pleasure to bring you a special message from our AHA chair of the Stroke Systems of Care Advisory Group, Dr. Lee Schwamm, and the incoming chair, Dr. Stephen Messe.
Hello, and welcome to the Get With the Guidelines Stroke Virtual Quality Achievement Awards. I'm Dr. Schwamm, and I'm here tonight with my colleague and friend, Dr. Stephen Messe. Hi, Steve.
Lee, it's virtually good to see you, as always.
Yes, and Steve, it's great to be passing the torch, or the crown, shall we say, as chair of the Stroke Systems Advisory Committee. Congratulations, and really looking forward to working with you in this new role.
Well, thank you, Lee. And I do want to say that, you really were instrumental in building Get With the Guidelines to the important, role that it plays today. And so thank you for everything you've done. And, you will always remain the emeritus king and ex officio forevermore.
Excellent. relentless together. I would say that's you and I will be relentless together in this task, but tell us what that means to the Heart Association.
Well, so relentless has always been, an important theme for the American Heart Association. And this year in particular, obviously, we had to pull together with all the challenges that we faced. And there's no question that we did that. And this is thanks to all of you and the hard work that you do. But it's clearly being relentless together was the key to getting through this.
Yes, and nobody demonstrated that more, I think, than our frontline staff and nurses in particular. And just want to take this moment to really thank all of you out there who work in the nursing profession, all of you who work to take care of stroke patients, but especially take this opportunity to recognize this as the Year of the Nurse, and we're all extraordinarily grateful to you for that. We've had some amazing accomplishments this year. The public reporting of Get With the Guidelines data is the next evolution in our goal to really becoming the source of truth when it comes to quality stroke care. Have 152 hospitals are now participating. This data gets used by U.S. News in its hospital ranking system and for some hospitals with health plans. So spring enrollment coming up beginning in May. If you're not in already, sign up. We're in. Steve, are you guys in?
I think we are definitely in. Yeah, it's
Excellent.
Very useful. So that's going to continue to grow. And speaking of growth here, of course, we're seeing continued enrollment in patients being logged into the database. So now over 7 million this year is where the threshold we passed. And by 2024, we're going to get to 10 million, which is absolutely incredible.
That could be more number of cases than I have unread emails in my inbox, Steve. Speaking of unbelievable growth, here's the just distribution of publications from this program, over 150 searchable database if you want to look and see on a particular topic or a particular module. But it's been a remarkable journey, and we've made such an impact on the care of stroke in the United States and had quite a showing at this year's International Stroke Conference.
For sure. And some of those have already been published. They were done in time with the stroke conference and are very relevant to all the things we've been dealing with this year.
Yes, and Dr. Srivastava with Dr. Fonero published this very important analysis in Get With the Guidelines using the new elements we added in Get With the Guidelines Stroke for COVID specifically, separate from the COVID registry, which was also launched this year, showing that patients with COVID who came in with a stroke had more severe strokes, more large vessel occlusions, longer times, but not statistically significant for some elements of care, but certainly for door to CT, door to needle, door to thrombectomy. But good news, rates of thrombolysis and thrombectomy were unchanged between the groups. So we did the job, it just took longer. Unfortunately, that also meant decreased odds of independence at discharge, higher odds of mortality, whether that's the combination of the delay plus the underlying illness or just the illness itself, we don't know, but it certainly adds fuel to the fire that COVID has an association with stroke severity that impacts patient outcomes. And, when you think about reasons why TPA wasn't given, not surprisingly, the need to put on additional protective equipment had a big impact on the patients with COVID-19, while the traditional reasons for difficulty treating or delays in treatment, hypertension requiring aggressive control with IV medication, much more common in the patients without COVID. And Steve, this is a really interesting study of disparities by race and ethnicity in the use of endovascular therapy among patients who arrived with an NIH stroke scale score greater than 6 within 6 hours, so eligible by time and severity, showing that there is still a persistent but narrowing gap between non-Hispanic whites and Black patients. Fortunately, short-term outcomes are as good or better, and modified Rankin at discharge was the same. Unfortunately, 90-day outcomes were worse in Black and Asian patients. We don't know why, but it's an important area of research, particularly as we think about social determinants of health.
Absolutely. Good news and bad news, but plenty of work to be done.
Yeah, and how about this for good news?
I like it. Increasing use of TPA within 4.5 hours, 80% now. That's remarkable. That's really wonderful.
And despite COVID, further increases in the use of TPA within 30 minutes, door to needle time within 30 minutes. They said it couldn't be done, and now we're doing it in more than 25% of the patients. It's really remarkable.
Yeah, hopefully that's going to continue to grow. And look at the EVT outcomes, recanalization.
I mean, we're now reaching the rates that cardiology has had the joy of living with for decades. And I think when you have 90% recanalization, now it's not about the device anymore. It's about selecting the right patients and providing the therapy in a timely manner. 24,000 patients got a TICI 2B or 3 score this year. That's really remarkable. And lastly, Steve, we need to do a better job of getting the right patient to the right place in the right amount of time. And nowhere is that more important than the pre-hospital arena. And this year we have a major consensus statement coming out of many of the professional societies in the relevant space here, with suburban, urban, and rural modifications to that prior Mission Lifeline stroke algorithm that came out more than a year ago. And I think this consensus approach to modifications based on availability of different levels of hospital capability is going to make a big difference.
There's no question this is an important statement that's going to clarify some guidance for many, many, many places. And it's great that we were able to accomplish that.
So, Steve, I can't wait to see you next year in the Big Easy.
I love New Orleans. I couldn't think of a better place to celebrate getting back together again, and looking forward to that. And I want to thank all of you for everything that you do, and looking forward to a better year ahead.
On behalf of all of the patients that we care for, all 800,000 of those patients, I want to say thank you to all of you for the incredible work that you do all year long. And we look forward to seeing you soon.
Be well.
Wow. Special thanks to Dr. Schwamm and Dr. Messe for sharing that exciting bit of perspective on the overall success with the Get With the Guidelines stroke contingent and other highlights from this year's International Stroke Conference. There was a lot to learn, and we really have a lot to be proud of, thanks to the fearless leaders of leadership of Dr. Schwamm and soon to be Dr. Messe. And a special thanks to all of you. You know, we really can't stress enough how Get With the Guidelines data has revolutionized how we take care of stroke patients everywhere, not just the select few places, you know, around the country that may give high volumes of a thrombolytic, be it TPA or TNK, or like high volumes of interventional care. But urban, rural, large, small, all of it has been positively impacted over the years through Get With the Guidelines. So of any sort of work that we do through the AHA in regards to stroke, I think this is by far the most impactful. And with all the hard work that each and every one of you do on this Zoom call, making sure that this information is brought to everyone, it really has a long-lasting effect, not only for our individual hospitals, not only for our individual cities, not only for our states, not only for the Midwest region, but for the United States as a whole. So on behalf of the AHA, I'd sincerely like to thank you, each of you, for your resounding commitment to all the communities you serve and the patients that you treat. Now, again, congratulations for being recognized, for delivering that award-winning quality stroke care. And I cannot wait to see each and every one of you in New Orleans in the Big Easy, where we can do this with a little bit of style. Now, I would be remiss if I didn't let people know that, or remind people that the recognition, again, was from the 2019-2020 data, and the data for next year's recognition is due at the end of the month. So just a little bit of pressure for those of you out there. I'm sure all of you know that and are well aware of it, but again, to really ensure that we've got that streamlined, please have it by the end of the month. And be sure to reach out to the local AHA QI manager for any support as you get closer to the deadline. Until next year at the Big Easy, signing off. Take care, everyone.